So if everyone at the back could come in and take their seats, we can get started, because we obviously want to keep to time, setting the norm for this conference. So good afternoon, everyone, and welcome again to Helsinki, and welcome to this first plenary session of the 2025 European Public Health Conference. My name is Martin McKee, and I wear multiple hats at this conference, but I'm here today on this platform as the strategic advisor to EUFA, and I'm going to be the moderator of this first plenary session. So our session is entitled Transforming Economies for Planetary Health and Wellbeing, and I think you'll agree it's a theme that could not be more timely. The COVID-19 pandemic reminded us painfully that health and the economy are deeply intertwined. And it also showed us that resilience, sustainability, and solidarity must be at the heart of how we think about the future, not just of health systems, but of our economies and society as a whole. Well, today we're going to explore how Europe can lead in placing planetary health and well-being at the center of economic transformation. We're going to look at how digitalization, innovation, and global cooperation can help us build systems that are not only more robust, but more equitable and more sustainable. So to set the scene, I am delighted to introduce for the second time today our keynote speaker, Sandra Gallina, who needs no introduction, but I'll say it anyway. Sandra, please come and join us. And Sandra, as you know, is the Director General at the European Commission's Directorate General for Health and Food Safety, DG Santé, and Sandra has been at the forefront of shaping Europe's health response. Do you want to join us at the podium, Sandra? Do you want to come? Yeah, you can have the podium.
Yes, my friend.
My pleasure. Sandra has been at the forefront of shaping Europe's health response in recent years, from pandemic preparedness to the development of the European Health Union. And I'm really pleased that she's going to share her insights with us on how the EU is advancing a transformative agenda for health, resilience, and competitiveness. Sandra, the floor is yours.
Thank you, Martin. You're always so, I would say, jocular in your introductions, and I hope to live up to the challenge. So, to keep everybody interested after lunch, because, you know, before lunch, everybody was awake. After lunch, it's a bit difficult. Now, you rightly said that the COVID-19, and very sadly so, was a wake-up call. We realized that our systems were not up to scratch. I can tell you that I could give you many anecdotes about the lack of data even, and the things we had to do, but we realized that we had to move on. And I would say that the first lesson is that not even the largest member state could face the crisis alone. So, a big lesson to us all, unity, unity, unity. That was the real beginning of the whole story. Let me also add that another lesson that we drew was that, well, of course, there was no time. You may say that out of necessity, we made a big virtue of it, but we didn't need to change the treaty. So there was no big dispute about competencies, and we could do what we succeeded in doing, which was a political choice, and I would say where there was the political will, we could find a fully legal way to do things, which was a fantastic thing. And I still thank all my colleagues in the legal service and in DG Budge for giving me the good approach to doing things by the book. Now, what did happen at that time is that we realized that we were not up to task, and when I was earlier in the panel, I said already what we went for. We went for our agencies. The mandate of EMA was expanded. The mandate of ECDC was revisited. I would say that we had many things that happened, and my most important part is that we decided that preparedness was a matter that needed to have a real European dimension. A small thing that you may not perceive from the outside is that the whole matter of health security acquired a different level. At the time of COVID, I had to deal with very junior health security experts. Now we have the senior level where all Director Generals of Health meet. We meet regularly. We have very, I would say, topical meetings. Some of them very recently concerned exactly this cooperation between civil and military. We could have, I would say, big discussions on this because it's not an easy thing. But the core of the whole revamping of the preparedness part was to create a more resilient system, because we cannot afford to waste a lot of money. It would be good to have many structures, but let me say to you, one fallacy, at least it's a personal view, one fallacy that I hear most of the time repeated is that we need big structures and, you know, let me say, if we were to keep in hospitals or also in stockpiles all that we needed during the crisis, we would be bankrupt. It's not a good approach. It's not a good approach. Your economic partners will not understand you if you go with that approach. What you need is a system that can spring into action, and this is why I would really like that our Union preparedness plan lives up to this idea of resilience. You, as I said this morning, you have a workshop here with my colleagues that you can go into more detail for this Union plan, which is, I repeat, not the sum of the national plans, but a different plan that needs to activate the European level. So we are very active on health security, as I already mentioned. We have partnerships in this respect, and I would like to say that we have very good cooperation. And so is the multilateral system a bit in difficulty? Yes, but we still continue believing that the multilateral system is a good thing to have, and we even foster, I would say, our grouping together into these multilateral systems. I must say that this morning I was mentioning climate change because for me, when I get the figures on my desk, you know, in 22, we reckoned and we calculated, these calculations Martin knows are always very difficult, but you know, we reckoned that at least 60,000 people died out of the, we can call it heat wave, but whatever was the climate reason that we attributed to the death. But I want to mention in particular now, instead of what I did this morning, I want to go into One Health. And why do I go into One Health? Well, again, because One Health will lead to prevention, will lead to actions that impede us from getting into trouble. And One Health can get very broad. You know that in Europe, I'm happy to be a One Health DG, because I have on the one hand my chief veterinary officers in Europe, and on the other the public health authorities. And one of the most difficult dialogues was this one, but by now this is a dialogue that is established. We have what I usually call a jumbo meeting. Why do I mention that? Because some of the troubles for pandemics start in the animal world and come up to us. And it's very important that these two realities in Europe are coordinated, are very well coordinated. It's my idea to have also plans for different zoonoses that might travel towards the man. Let's see if this flourishes soon. For next year, I would really love to have an avian flu plan, because I can see that coming. Now, prevention costs. I have here a few figures. And you know, this is World Bank figures, and when they manage, I would say, their numbers, they say that a pandemic can cost 30 billion. Okay, let's see. I think the figures will be even higher. But to do something in terms of getting ready for a pandemic in a One Health mentality is between 10 or 12 billion. So, you know, 30, I think it's on a very small scale that 30 billion would cost against 10 or 12. I would like to quote, and I do this out of my affection to Otto Kaas, who is a real force for good, the antimicrobial resistance issue. This is an issue that is totally underestimated. I have met him in Stockholm last week when we were celebrating 20 years of ECDC, and he's still very much worried. He's still very much worried that we're not acting yet up to standards. The whole of Europe is trying to move towards good policies on antimicrobial resistance. The Swedish presidency, and praise goes to the Swedes for what they do on antimicrobial resistance, issued a recommendation by the Council, but let me say to you, I still see many countries in Europe that are lagging behind on this. You know that Europe has become the first area of the world that has banned, I would say, antibiotics or antimicrobials for prophylaxis, animal prophylaxis. So, you know, we don't want our chickens with antibiotics because we know what it does to the rest of the environment. But for as long as not the rest of the world does not move with us, we have a challenge. I am very frustrated that at UNGA last year, we could not get this declaration to stop giving antibiotics to animals. So let me say to you, this One Health needs to come forward, and you are all health experts, much more as the prevention moment for societies to be ready for what is possibly coming. Now, I mentioned the Climate Observatory this morning, but I would like to mention another observatory that we are very fond of, and it's the Observatory for Health Policies. Martin is one of the deans, I would say, and I would like to thank all the colleagues that work there. It would be a bit invidious to mention all of them, but let me say, when you have studies produced by the observatory, you can go by those studies because they are independent and they are serious, and they try to project really a more global vision of health than the one that is projected possibly by one actor or another. Let me be a bit more, I would say, political and go into a domain which is very critical, which is the domain on non-communicable diseases. So we leave the shores of the pandemics, of whatever can be transmitted. And as I said, I will not repeat climate, but you know, it's very important that we realize that in all that fight for the pandemics, we are fully committed to end, and successfully so, a pandemic agreement in Geneva. We are fully behind this effort. We are trying to get, I would say, the negotiations to reflect what would be realistic, and perhaps I will mention more about this later because it's part of our global strategy. So on non-communicable diseases, I think that we try to convey to you all our commitment through very specific actions. We had Europe Beating Cancer Plan. By the way, this plan has been fully audited by the European Court of Auditors because it's a plan with a lot of money. We invested over 4 billion euros in this plan, thanks also to the good cooperation of the RTD and other DG in the European Commission. So we had fantastic cooperation. The missions that were there for cancer were fantastic. I saw Professor Riccardi somewhere today here in the room. My point is that we get attacked because we could be doing much more. I know, we could be doing much more, but let me say, we started with a good project, and I think we will follow through till the end. And we are now launching ourselves, because of the very firm commitment of our commissioner, into a cardiovascular plan. He's a believer that cardiovascular needs to be tackled. In fact, it's true, because unfortunately, it's the first cause of death. And this is very bad that we start these comparisons, because we don't want to have the most, I would say, competitive in this respect. But the cardiovascular plan will have also a section which will be a bit different from cancer, which has a lot of, I would say, the digital part, because by necessity. We are in a different era where we have the EHDS already there, and I'm happy to have in the panel Fidelia, who has been working on the EHDS from the early stages. Here, let me say, the most important part for you is to understand that we cannot do it all, but we're trying by pieces to digest the non-communicable diseases as much as we can. I mentioned tobacco this morning. The health determinants are very important, so we want this to be at the forefront. My final words will be, I would say, for all that can be done, of course, in digital. But here, the only thing that I want to say is that we will need a lot of trust, and that we are investing quite a lot of money for the infrastructure. The member states are fully committed. They have realized, even the ones that were more resistant, that this is an opportunity. It's a huge opportunity to give more personalized health treatment, but also reduce costs. Let me say this is what is driving the thing. Now, let me be very clear. We want to have an ethical, transparent, and explainable AI system in this digital saga. So it will be very important that you also, as experts, help us. Final words on, of course, health systems and medicines in general. The health systems. We here are trying to maintain our footprint on the money that is there. And what do I mean by that? We have EU for Health, which was a fantastic flower that blossomed. We will go into a new era where we will have a European Competitiveness Fund. I must say the challenge is big, but with your help we can put across the message that this is important, but I'm still keeping a foothold as a DG that keeps discussions on the recovery plan, the European semester, and on the cohesion funds. Whichever shape they take in the future, let me reassure you, we will definitely have health present there. On the, I would say, health systems, I want to make you aware that we have seen that member states are spending a lot of this EU money, whichever source it is, in ICTs, meaning the digital part, the information and communication technologies, and in the small space of the post-COVID, we have had an increase of 30% as against what was invested before COVID. I could give you the precise years for this figure, but let me reassure you that it's all money that is well spent, because it also helps you as patients to travel Europe with your data and to have immediate, I would say, treatments without having to duplicate your analysis. I'm simplifying to the utmost. And I come to the final big pieces that may be coming, and Martin will be relieved that I can evacuate this podium. The big pieces will be, I would say, big. I mentioned already one, which is the cardiovascular, but you know, we are in pharma discussions. Everybody knows how these discussions are going. In my view, they're going very well, because I sense that even though the landing space is not yet there, there's a lot of convergence. There's no time to waste here on these matters, because many things are happening geopolitically. And this is the issue, that we have this fragmentation geopolitically that it's putting pressure on us. We issued also the Critical Medicines Act, but let me say that for the end of this year, there will be another magnificent piece, which is a revision of the medical devices, in vitro medical devices too. Why? Because the regulations were stultifying the very purpose of the regulation, meaning that they had become so difficult to manage that we would have involuntary shortages of medical devices for patients, which is very bad, And finally, we hope to be producing a big, beautiful Biotech Act. I'm sorry to borrow that sentence, but you know, really biotech there's such an urgency for that, also because we need to regulate, not just to liberate, but also to regulate. Let me say something which is not very nice. Everybody is urging me to simplify and not to simplify and to do this, to do that, but I would say it's very important that the Biotech Act opens the gates to research, to innovation, but also tries to discipline the misuse of biotech, which we know very well where it leads to. So I'll stop here. We are fully committed on the international agenda, as I said, and it's not just this pandemic agreement, but it's also next week for the Convention for Tobacco that I will be personally there in Geneva. Where there is multilateralism, there will be Europe. Vive l'Europe. Grazie.
Thank you. So, just have a seat. I don't think anybody can be in any doubt that the European Union is a key player in health policy today, not just in Europe, but worldwide. So thank you for that tour de force of a portfolio of all the things you're doing. And I'd like now to introduce the other members of the panel to look at how we translate this vision into action. So first of all, could I welcome Rui Santos Ivo? who is the chair of the European Medicines Agency Management Board and president of Portugal's National Authority of Medicines and Healthcare Products. Please, Francesca Colombo, who is head of the Health Division at OECD and well known to audiences at this conference, and Fidelia Cascini, who's a digital health expert and a professor at the Università Cattolica di Sacro Cuore in Rome. Each of them brings a unique perspective from regulation and innovation to health systems and digital transformation, and together they're going to help us reflect on how we can build a resilient, equitable and sustainable health system that promotes and supports both planetary health and economic prosperity. And I also want to introduce my colleague, Paula Del Rey, standing at the corner. You will see that there is a Slido on the screen. Paula, like myself, wears many hats. She's working with me at the European Observatory in London School, and the most important thing is she's lead author on a new book on demystifying AI for health policymakers, which hopefully will be out this year. So, thank you. Paula will be collating the responses to the Slido. Rui, let me start with you. So, we're talking about improving the competitiveness of health systems and industry. It's a top priority in Europe, but when I look at the latest figures that I could find, American-based firms supply about 38% of our imports into the EU. Switzerland close behind at 33%. We're really reliant on global supply chains. Now, Sandra has talked about the importance of securing Europe's strategic autonomy through initiatives like the Critical Medicines Act you mentioned, the forthcoming Biotechnology Act. So in this context, how can the EU continue to provide an attractive, innovation-friendly environment for research, development and production of medicines in Europe? And in particular, I wonder, this is getting to be a very Italian panel, I realize, but if you could also comment maybe a little bit on the implications of the Draghi report on the future of European competitiveness. Rui, start with you, and then I will come to the others.
Thank you very much, Martin, and thank you also for inviting me to be here. It's a real pleasure, and particularly also to be with the colleagues and with Sandra Gallina, a very good friend from also the times of the COVID.
It doesn't look like that.
Martin, I think Sandra mentioned one thing in her introduction, which was the wake-up call that we had with the COVID. And I think this is really important that we are looking into all the aspects, that we are working together, putting things all together. So avoiding fragmentation and reinforcing cooperation, because I think in this way we will be able certainly to overcome some of the let's say the limitations that you mentioned in terms of competitiveness, in terms of the lack of research and development that we have in Europe. Also to put the connection between health and these objectives. To come a bit to my nature, which is a regulator, I see us, and Sandra mentioned this at the last point when she was mentioning the biotech, that we as regulators, we have a responsibility of bridging the two sides. So on one side is how we are completely aligned to develop and to push for more simplification, for more streamlining, for more development, but also to ensure that we are bringing what is making a difference in terms of public health, or in terms of health, and in terms of patient access, in terms of responses to health. I think in this context, I mean, we are doing a lot in Europe. I have never seen so many things going on in terms of really making a different situation. And Sandra, it's really impressive. And also, one thing that I have to say is because you are also so open and so close to working with the member state, that this makes a big difference. So I think when we have all this momentum with all the initiatives, and when we see Draghi's report with this actionable roadmap, with the recommendations, I think they are very, very important to be then translated into concrete action. When we see closing the innovation gap, when we see in terms of reinforcing our capacity, when we see to really identify where are the priorities. And here I think the regulatory authorities are also taking their part. So they are now having their own strategy, a joint strategy, the European Medicines Agency, the national agencies, that is translating also these recommendations and putting them into action. We are looking to access, we are looking to using the data, using artificial intelligence. We are looking to how regulatory science can serve the development of clinical trials, how regulatory science can also help scientific advice for more competitiveness. We are also having a clear action on preparedness, on all these aspects, also on One Health, and also on availability. So on getting more capacity in terms of European. So I think we are in a very good momentum, and we are very much cooperating and working together so that we could overcome fragmentation, that we can go to the first word that Sandra said, to be as much united as we can, because this makes the difference.
And as we've heard with the current geopolitical situation, we have to be. It's an imperative that we are. Francesca, can I move to you and maybe link it a little bit to the mention of the Draghi report? Some of you know I and colleagues have been a bit critical of it because it was very good on biotech and life sciences, but it didn't talk so much about the health of the European population and their contribution to productivity. But we know that the traditional economic indicators like GDP give us a very narrow view of societal progress and don't really capture these issues of health, equity, environmental sustainability. But there are alternative ways of measuring the progress of nations, and in particular, OECD has been working the Better Life Index, which has health, education, environment, and things like that. So, Sandra highlighted the EU's opportunity to lead this transformative agenda, centered on well-being, and I stress well-being. We are here in Finland, which of course is one of the homes of the concept of well-being, resilience and sustainability. So can you help us to understand how the OECD countries in Europe, and of course you go far beyond Europe, so draw on other examples from the rest of the world if you want, use indicators like the Better Life Index and others to guide such transformations, and how these countries can really embed these multidimensional well-being metrics into their health and economic policies so that planetary health is really a driver of growth and not just rhetoric. Please, Francesca.
There's more question. Look, first I want to link back for what Sandra has been saying, has been talked about a lot of challenges. What these challenges have in common is the need for an integrated policy response. And that's where the notion of well-being and health within this context can be helpful. Now, I want to talk about two main aspects. One is the measurement, and then what you alluded in the last part of your questions is how do we then move into action and policy change. Now, on the measurement side, it's true, OECD has been working for quite some time on the issues of beyond GDP, but I also wanted to mention the work that we have been doing to measure well-being from the patient's perspective in health system with the Paris Initiative, the Patient Report Indicator Outcomes Initiative, which really tries to see what matters to people, and it's a fundamental dimension that we need to do. But also trying to say, okay, if you want to make the best for individual societies, we really need to talk about different dimensions of well-being that matter to them. Health is one, but there is obviously education. There are issues related to their concrete material well-being. So, things like income, housing, they all are quite important. And since the then commission, which was a Sen, Fitoussi, and Stiglitz Commission, that was in 2009. We have been measuring this Better Life Index. It does help to identify those dimensions that matters to individuals and help to identify also some of the policy trade-off. Now, the trouble comes to, how do we then use this measuring to really make meaningful change in practice? Now, there's been some progress. A number of countries have introduced multi-dimensional well-being frameworks. That's purely in terms of measurement. There are some countries that are using well-being as an issue when we're talking about evaluation of new and appraisal of new initiatives, so things that are added on, they're evaluated from a well-being perspective. Very few, but some introducing a well-being budgeting. The fundamental issues, though, is that if we want to have meaningful change, we really need to have an honest and open conversation with other sectors in the economy and understand that those other sectors might have objectives which in some cases are not entirely aligned with health. And that's the difficult conversation. And in order to do that, you need to have a way of measuring what is in from them. So if you implement public health policies that we know are not just those within health system, but are beyond the health system, what is in it for the agricultural sector? What's in it for the education sector? What's in it for the economy more broadly? And that's what we've been working on as well at the OECD, and particularly in the work in the public health team, trying to quantify those co-benefits from the perspective of these other sectors that we must build alliance to. And so essentially we have used our public health models, and we try to measure what's the impact of those, not just for the health of population, but for all of those dimensions of well-being of the Better Life Index framework, which matters to other sectors. We can then go on whether this happens all the time, but unless you start that conversation and start to saying what's in it for the other sectors, it's going to be very difficult to make policy.
So this is really a hugely important thing, because we do know that, and I know that you may not be able to comment on it, but I will, but we do know that people being left behind and lack of well-being is driving some of the political forces we're seeing in Europe. So I think for those of us outside official organisations, clearly we have a strong incentive in you succeeding in doing this. So Fidelia, can I turn to you and talk about AI, because Sandra's already talked about this transformative potential of AI. Now, the EU is doing things like the European Health Data Space. One of the things that a lot of people are concerned about is the governance of all of this, and particularly linking back to issues around trust and exchanging and surrendering your data. How do we protect privacy, promote equity, while actually getting the benefits? Could you share some of your insights on that?
Yes, thank you for the question. First of all, I would say that the European Union is perfectly on track to find a balance between the governance of AI in an ethical way, a trustworthy way, and respectfully for privacy and other people's rights, and innovation. So I think that nowadays European Union is really the best way to live, also under the perspective of the futures of innovations and the implementation of these innovations in our daily life. Secondly, I would say that, from my perspective, the governance of AI should be centralized. This is true at the European Union level, but also at the national level. And why this is important? Because this is essential to avoid fragmentations, to facilitate harmonizations, and also to find a common understanding which means implement interoperability under all the dimensions, so the dimensions which are technical, semantic, organizational, legal, and this is important if you have a unique vision from a central perspective. And also it is essential because when you have a centralization, you can have a common understanding also to understand the interplay between all these different regulations. So let's think, for instance, all the regulations which are relevant in the healthcare sector for the implementation of AI. We have the AI Act, which is horizontal in the different sectors, but also regards healthcare. We have the European Health Data Space, which is essential to collect data for the implementation and the training of these technologies. We have medical device regulations and in vitro device diagnostic regulations. We have the health technology assessment regulation. So how can we create an interplay, a common understanding of all these regulations if we don't have a common vision, a common understanding? The second consideration that I would share with you is that you can have a good governance for AI if you have a good governance for the use of data. So a good data governance in the healthcare sector, and in this sector, the most important reform that we have now in Europe is exactly the European health data space. Why it is so important? Because it is something which enables the availability of data for secondary use. So all the uses for research, policy, for training of AI, innovations, regulations. So you can use all this data for all these different uses, and you can have different sources of data, and you can have all different categories of data in the healthcare sector. So if you see, for instance, the Article 51 of the European Health Data Space, you can see a list of so many different data categories which can be used for the innovations, for the implementations of the future. And why it is also so important? Because all the secondary use of data is under the control of public authorities. And this is so important to build the trust, to have a control of the environments, of the conditions where to develop these technologies for their use in the healthcare sector, which is, as we know, a so delicate sector for the future.
Great, thank you very much indeed. Now what I'm going to do is, we're a little bit behind time, so we'll run through a couple of other questions. And then Paula, are you getting questions in from the audience?
Yes, many.
Many. Okay, so very, very quick responses, if I can just ask you. So Sandra, so we've talked a lot about competitiveness in healthcare and innovation. So how do we balance that with the European social model, solidarity and access to care?
Now, let me say to you, you have to have in your mind the landscape, the demographic landscape of Europe. It's very important that we do not shy away from a discussion on competitiveness when it touches the shores of health. And you know, with medicines, we are steeped into it. With RUI, we have quite a lot of it, because being autonomous and self-reliant sometimes is at the expense of some of the budgets. I will not go into the detail, but let me say, nothing is a free lunch. If we want to have absolutely everything reshored in Europe, it will be very expensive. So where is your competitiveness in then producing from the reshoring of APIs your products, let's say? I leave you with the answers to this question, which you know very well. So for me, what is important is that you realize that we will need a very serious discussion between, we have a certain demographic profile, we will have certain expenses in our systems. What is the most competitive way to tackle this? In my view, we have already started giving answers with the AI, with the digital, but I repeat, this needs to be ethical. This needs to be very much in a trusted environment. We also will have quite a lot of answers, I think, in trying to, and this is going a bit far, but trying to think into procurement systems. And I don't want to say more, but it's clear that the Critical Medicines Act attracts a lot of attention from the member states, because by pooling, you can do certain things. And I don't want to go into the geopolitical, but it's by necessity that we'll need to stand our ground. So I would stop here, but really be lucid that we're still the largest producers of medicines. We have an enormous set of small and medium-sized enterprises on medical devices, in vitro medical devices. We are very strong. This is an ecosystem that some would wish to have, So we should not waste it away with ideology, but we should try to, compete, trying, and here you're right, perhaps one cannot comment, but we were one of my dearest presidents, Juncker, always said, never make proposals that divide Europe into South and North, East and West. Inequity or inequalities is not my line of trade. We want to get to a place where there is more equity, more, I would say, possibilities of access to affordable medicines, affordable treatment, affordable care. That is where we want to go. So stay the competitiveness angle, but in a positive way.
And so, Rui, a similar question to you, but I'm beginning to think, listening to Sandra, that in fact the work that EMA does can in some ways be recategorized as health security, because it's the security of supply chains, the security of the health of the population. I mean, this goes back to the 19th century when a healthy population was needed for fighting wars, but that may not be the argument today. But it is telling us that we need to rethink the role of agencies like yours.
I fully agree with you, Martin, fully agree with you. And I think this was also something that we learned with the pandemics. It's that we will need to reinvent ourselves, and that we should be different. And I think we are in this path. Of course, keeping the science as the strong basis, we have to. We also, of course, need to keep what are the needs that we are to solve. But in this way, we are more than the traditional regulators. We have to be much more integrated. And when Fidelia was talking about the digital and the AI, so all these aspects, we need to put them together. And I feel that we are doing that. So that's where I'm very satisfied that we have this convergence window where we are doing a lot of things. And also we as regulators, and when I mean regulators, I mean in a broad sense, because it's not only the medicines agencies, but it's also the other agencies like Sandra mentioned, that are working more closely so that we can see how together we can really respond.
Great, thanks very much. And a quick question, a couple of other quick questions before we go to the audience. Francesca, we'll have all these data on well-being and quality of life and so on. I just wonder if governments really want to know that information, particularly when they look at regional disparities within their country. I mean, I live in a country with massive regional disparities, and others do as well. Do they actually want this information?
Well, yes and no, of course. But it goes back to the issues of how to really drive meaningful change. I mean, the metrics are something, then you can look at the metrics and say, well, I do nothing with that. So just the metrics will not bring you to the results that you want. So, of course, I mean, the issues I mentioned, co-benefits, returns on investments, fundamental issues, speak the language of those who are in other sectors, and that will matter to them. But it does not stop there. There is a big issue of addressing some of the systematic failures. For example, political cycles are quite short, we know. But actually, if you have alliances with local communities, well, usually also the political cycle at community level, it's a little bit longer. And those are people that can really help to drive some of those meaningful change beyond the short-termism of the more national political cycle. So, those alliances are fundamental. I think we need to be much more innovative in governance and in budgeting. And to be fair, there are some things which are happening. We see examples of well-being budgeting, of performance budgeting, which are being implemented, multi-year budgeting, or ring-fencing of some of the areas. These are all things which actually really matter to make sure that we can address those levers for change in the longer term. And I think also we need to be much more attentive to successes and implementing best practice successes. Quite a lot of work that we're doing with the Commission on that, on the implementation of best practice, so I just wanted to draw attention to that as well.
Okay, great. And sticking with this theme of differences across Europe, Fidelia, to what extent do you think that the different member states have got their governance arrangements in place to take full advantage of all of these things that Sandra and her colleagues are driving forward? And what do we need to do to make sure that they're all at the same level?
I think that we should look at these issues with two main mechanisms or solutions. The first one is related to the approach. We should implement a scientific, rigorous approach, as Galilei reported in the past, and which
I told you it was an Italian panel.
Yes, which is the base to build evidence-based scientific solutions, and we should apply also this to AI to find results which are the results from controlled experiments that could be reproducible, and that for this reason they could be transparent, and they could be reliable, and they could help us to understand what is the mechanism behind the solutions, the new solution. And secondly, I think that it is very important a focused, targeted education campaign. We should increase the level of awareness of the population regarding these solutions, regarding the impact of these solutions, and regarding the methodology behind the solution which are proposed. And looking at this approach, it is essential the role of the competent authorities, because to build trust, it's essential that the information is coming from the public entities, the authorities which are competent in the single matter. So if we educate people to ask the right questions, maybe we can also find at the end the right answers.
So one of the analogies that Paula and I have been looking at with other colleagues is with AI at the minute, we've got people who are building, like in the 1920s, bigger and faster cars. And our role in public health sometimes is to say, that's great, but maybe a steering wheel would help, or wing mirrors or seat belts would help, and maybe a driving test might help as well. So maybe we need to look at how we can develop that sort of thing. So Paula, what have we got from the audience?
Thank you, Martin, and thank you to the audience. It's been a really active discussion. So we've touched on many topics online, some of them around the impact of AI in climate change and the environment, also around community involvement and breaking silos between professions to make sure we advance the agenda on planetary health. And then there was one question which is quite popular, which I think touches on this wider topic on transforming economies that we are talking about, which is this tension between commercial interests and the public good. So they were asking, how can European powers ensure that research funding betters science for all and not for just a few?
Yeah, so this is the issue of, our Europe. How do we make sure that what you're paying for really benefits the people of Europe? Because, I live in a country which took a different view, and we've said that we need, you set out all of the things that you're doing in health, but we need to make sure that people appreciate the benefits. How are we going to do that? I'm going to ask the two of you to help me with that one, and then we'll go on to some of the other questions.
You may be living in such a country, but you're Irish, and Ireland loves Europe. So, let me say, this is a challenge for myself with my teams too. When the European Court of Auditors comes, they say, for instance, how can you tell us that, you are successful in cancer? One KPI could be how many people got treated and cured. Yeah, well, I say, it's 3 years for cancer. It's not necessarily that. So going out from the anecdotal, are we sure that we are financing the right things? It's you who needs to tell us. That this is where I think I tried also, even with the small hook of our agency, executive agency, Hadea, to get policy feedback, to say, what is it that and we go back to the best practices. There are many successful things that a member state is doing. Why don't we replicate it? We are as good as we can be in the weakest link. Why don't we improve all the weakest links and we go on? So my first answer to you is that we need you. Again, I stress this. I came here to Helsinki because it's very precious to me to be here with you today and to say, guide us. What is it that we need more? And policy can become really the tool to direct the money and to direct even the money of the member states, because nobody likes to be scoring poorly on health. Health brings down governments. Remember, health has become very political and it brings down governments. So everybody wants to look good. Everybody wants to be nel salotto buono, as they say in Italian. They don't want to look like I'm not the one doing the right thing. So please steer us from your side. Of course, there will be, this is what I said this morning, there will be this increasing pressure, and it's not as it used to be in the past. I don't dissent, but it's true that the economy has, I would say, an inspire and expire system. But now we have, in this economy, we have the threat of war. And this is what is getting the budgets deviated quite massively. So we need to stay the course of healthy societies. 19th century it may have been, but it's still today.
Still important.
A society that is riddled by issues of bad health, including obesity. You may look across the pond and you may wonder why Maha is so popular. It's popular because we have many people that live in inequalities and have very poor health, but it's also popular for other reasons that you may surmise here.
And so the EMA, on the side of the people, how do we make sure that that is both a reality and a reality that is projected to the people of Europe?
Martin, I mean, Sandra said it all. I cannot agree more with her, but it's this connection with the authorities and with the member state that is essential. And I think this was, again, a lesson that we had with the pandemics, because we saw the concrete difference when we had Europe at stake, because then Europe provided a solution for all of us, and we could really feel the difference when this happened. So I think here this coordination, and Martin, on my own field, so from the EMA side and with the agencies, we are more and more, and Sandra knows that, more and more working together. So it's not anymore an agency, and the national agencies is a network, is a good connection that we are working towards the needs of the member states, the needs of the concrete patients that are not living in a specific place of Europe, but are in the different places of Europe. So I think this is how we need to continue working.
Great, thanks. Now I think Paula might have a question for the two of you. Paula?
Yes, so we had a few people asking a question that I'm sure has been discussed in this forum many times around how can we work with politicians to make the case for prevention.
So I think that's a question for how can we collectively here. Francesca, you work with politicians all the time. You're coming more from academia. So what are the tips that you have learned that can help us to be more effective in promoting our message?
It goes back to what I've been saying. I mean, on our work on public health, and particularly in the economics of public health, we try to look at the economic case for investing in preventions. And so we look at what would be the returns that investment in some public health policies deliver, both in terms of returns on investment, so each dollar investment, what gives you in terms of returns, but also seeing what are the implications that this have for labor market outcomes, for GDP growth, for skill formations, and so forth. And this is quite powerful and speaks quite a lot. Now, it's not enough. I mean, and if we look at the data from what happens throughout the pandemic, spending on prevention went up, and now, unfortunately, it's down to where we were before. So even if we have been saying for many, many years about those economic returns on investment is not enough, we need to work on the policy-making processes on this. We need to have dialogue between health and finance ministries. We have a senior budget and health officials dialogue where we try to educate them, but also be educated by what is important for them, because in a way, you only can achieve a meaningful change if you are also attentive of what the person who is in front of you at the table, what is important for them. So it's really working through those barriers to change, which I mentioned, which are really quite fundamental. So it's it goes back to the governance, the budgeting, the systematic failures to be addressed. But we will continue to do this. So do reach out to us. It's really one of the core priority for our work on health at OECD.
So Fidelia, any tips for us?
May I be sincere? May I be sincere in
yes,
my
answers?
Yes,
please do.
Okay, I don't think that it is possible to educate policymakers towards prevention, because prevention is something that you cannot allow you to collect immediately results. So it is not politically attractive for politicians. Maybe we should invest more in educating people and trying to implement a bottom-up actions to help people to ask what they need and to increase the pressure on the politicians to obtain the right answers. I really think nowadays that this is the only solution that we could have in the next future, because prevention is something which requires visions, and maybe currently politicians doesn't show visions towards the future.
So this is the case for a very vibrant civil society, please. Now, Sandra, I'm conscious that you need to get away a few minutes early, so just go whenever you have to. And Paula, do we have another question from the audience?
Yes. So our most popular question is around sharing best practices across Europe and whether we are actually making use of the best knowledge which is already available and being generated by the countries. And there was a bit of a specific question around the work that has been done in Denmark around the impact of social media on child and adolescent health and raising the age limit for social media. I don't know if the panel had any thoughts about this.
So sharing best practice, I mean, we had the example of the impact of social media on child and adolescent health. Just to follow up on Hans's comments earlier, we published a paper about a week ago on exactly this, so we did anticipate the question, and with some of my colleagues from Glasgow. So, but are we doing enough to share knowledge across Europe?
No.
No. No. Please.
We're not doing enough because, you know, there are too many distractions, and the distractions come from the fact that we are running from one emergency to the next. And let me say to you, Rui stresses the fact that I work a lot with the member states, but I have a lot of empathy for the member states because, you know, they win or lose their elections on the basis of matters that explode all of a sudden. You know, let me say, I repeat, I am a One Health DG, so I have very often food safety scares. And you know, governments may lose the elections because there was a certain food safety scare. I will not mention it, but it's clear to you that there are some examples. So, by being constantly under pressure with the short-termism, and I share up to a point Fidelia's pessimistic view. I do believe that it's not just bottom-up. I do believe that you can speak with politicians. If you say to them, a cancer that is treated preemptively, it's 3,000 euros. A cancer that is treated too late is 300,000 euros and possibly fatal outcome. They know that they will also lose their voter. The voters, at the end of the day, are less and less attracted by the opening of hospitals. In some parts of Europe where we have hospital deserts, this may look like a solution to open a hospital. It looked as a solution to some of our parts of Italy in the past, but today people know that good health is basically residing on the first chain, the first element of the chain, which is a good general practitioner. A good general practitioner you don't invent. You need to have a system for good general practitioners, a system of rewards, a system of sufficient pay. Every country is dealing with this because, you know, keeping a practitioner in a very remote area is very difficult. So let me say to you, health is much more than just simply a pill or something. You need to have a chain of elements, and hopefully you never get to the final one, which is treatment in a hospital, heavy treatment, even innovative treatment in a clinical trial, which I want. But let me say, the general practitioner, starting from the very basic, and you win votes if you have that. So
great,
they will be convinced.
1 minute from Francesca.
I'll be very quick, just because best practice was mentioned. So we are doing quite a lot to share best practices, and thanks to the Commission who is giving us work on that. So we have reports on sharing best practice on urban planning, on integrated care, on mental health, upcoming on substance abuses. We have developed a methodology for identifying best practices and sharing them. So I just wanted to mention that.
Thank you very much indeed.
Brava.
So I'd like to thank all of our panel. Thank Paula. Thank all of you. Thank you very much. Thank you. And enjoy the rest of the conference.
Stay the course.
Thank you very much.
Thank you, Martin.